Good evening, Door County. This is Door County Medical Center Live. I'm Dr. Jim Heiss, Chief Medical Officer here at Door County Medical Center, and I'm joined once again by Sue Powers, Health Officer and Public Health Manager. Welcome. Thank you for being here.
Thank you. Thank you to Door County Medical Center for hosting this, as always.
It's been, we look back, and it's the last time we did this was, with you and I, was January, I think 18th or something like that of this year. So it's been, what, 7-8 months since that time. So here we sit.
Time flies. I wouldn't have thought it was that long.
Me too. I wouldn't have either. And I will admit to anyone who's watching that I can't say that I was looking forward to doing one of these again. I kind of hoped that maybe this would be over with and we wouldn't have to be thinking about this, but indeed we are. So what we hope to do tonight is what we've done right along for those that had joined us over the last year and a half as we've gone through this is we'll try and give you an update to the best of our ability and then answer whatever questions you may have on this. So it really feels like the character of this time is different than last time. Sue and I were talking about how last time there was a little more, I guess, community camaraderie related to how do we get past this, what do we do, so we can get moving on to normal lives. And now it's become even more polarized than it was before, which is really kind of unfortunate. And for healthcare workers like myself, it takes a toll. I will tell you that. I mean, this is what when the Delta variant started to pick up steam, and there were some that were choosing to deny it or to poo-poo it or to sort of say, well, I don't think it's a big deal. I was literally thinking, I just can't even deal with this, you know.
Right.
So, you know, I'm the first one that would rather this not be real. But unfortunately, you know, I don't live in fantasy. So here we are. So with that little commentary, should I leave you open for your counterpoint, or otherwise we'll just let's talk about what stats we have,
Sure,
and we'll kind of go from there, and I'll try and get my computer set up for questions.
Yeah. Well, I kind of want to just say I would be the first one to not want this. You said you were the first one to not want this, but
You'd be the first.
I'd be the first.
True.
And so what's happening, yes, obviously we're here because Door County, along with the rest of the country, is having a surge in cases caused by the Delta variant primarily. And you know, as everyone should know by now, it's highly infectious and spreading more quickly than other variants. It's a whole new game. And I guess we all need to keep in mind that the pandemic, the COVID-19 pandemic, is very much an evolving situation still. As Dr. Heiss just said, I think all of us wanted to think that we were able to coast to done soon, but it's not going that way right now. The SARS-CoV-2 virus continues to circulate and new variants continue to be identified. So at Public Health, we were doing our situation updates weekly. As of today, we're going to be doing them twice a week. And so from last Thursday, we'll do them Thursdays and Mondays. Since last Thursday, we have 7 new confirmed cases. And just to give some context of the increase, in June, we had a total of 10 confirmed cases for the entire month. And then in July, we had 17. And so far in August, we have 16 confirmed cases, so half the month, and we almost have as many as July. And then further context for the state of Wisconsin, the 7-day average number of cases has doubled since the first week of August. And it is actually 11 times more than a month ago. So really headed in the wrong direction. Some people ask me how many of those cases are the Delta variant, and I'm not sure if everyone understands that genome sequencing, which is the specialized test for variants, is not a diagnostic tool. It's not done on every PCR test or antigen test. It's not done on every sample. It's not done to inform patient care. It's just done on a sample to let us know what variants are circulating. So 80 to 90% of the cases in August that were sequenced at the state lab were identified as Delta variants. So it's really here. And they'll continue to test to see what other variants might come in or keep on top of that. Do you want to talk about R0 with Delta?
Well, sure. I mean, I guess one of the things that I'll add on to that is I think you were saying what you said about it doesn't matter if the COVID, if you test positive, it doesn't matter if it's Delta variant or not as far as treatment. We still are under the same kind of lack of active treatments for this virus. So whether it's Delta or not is probably less important. I don't think what we've seen is that people that have the Delta variant are sicker. And in fact, I will tell you that from my perspective, to me it doesn't matter. I assume that they have the Delta variant. And once they're sick and in the hospital, that's sort of irrelevant to the equation. I mean, the treatment and the way that we take care of patients is the same regardless of what the variant might be. The big area where Delta becomes important is understanding the difference between the infectivity of the current variant to what the previous variant, to what we would call the wild type, the original SARS-CoV-2 that we saw during the surges in the fall. The big difference is the infectivity. When we look at an infectivity number, that's called the R0, and it's just R with a little sub-zero. And it doesn't really matter what that's about, but R0 just means how infective is it. So what that means, the R0 of the first virus in the last fall was 2, which means that if I had it, I could transmit it to 2 people. That's about all I would transmit it to, and my viral load in my nose and mouth would be spent essentially on those 2 people. What we're seeing with Delta variant is that the viral load is a lot higher. There's a lot more viral particles. They're able to replicate themselves a lot more efficiently because of the mutation, the variant that's happened. There's a lot higher viral load, and so the R0, the number of people I could infect with Delta, is 6 to 8. So I can infect 6 to 8 people. And so it's much more efficient at spreading itself. And again, we've talked about this. For those of you that have followed along this entire time, remember that a virus doesn't have a will, it doesn't have a brain, it doesn't have anything other than it's an organism that lives to propagate itself. That's all it's there to do. And so it means that it's gotten more effective in what it does. And so because of that, that's kind of why we're back to, there's a lot of discussion, and maybe we'll get into it a little bit later because I want to hit questions. That's why we're back to why should we mask even if we're vaccinated? And that has to do with the fact that even if you're vaccinated, you can still have virus sit in your nasal passage, in your mouth. Even though you as a vaccinated person may not get sick, you can give it to someone who might not. Now, we could then jump to the next piece and say, well, that means that if you're not vaccinated, it's really on you to either get vaccinated or keep a mask on, because you're either going to be vaccinated or you're going to get sick. That's pretty much where we're headed, the way the numbers are starting to show. But let's go ahead and take a look at some pictures. Why did I say that? Take a look at some pictures. I'm reading one of the questions as I'm talking. Look at the questions, rather. I think the first one was answered since the beginning of July. How many have tested positive? You answered that already. When booster shots are given, does the patient need something from their primary care provider to state that they qualify? Well, right now, the only qualification for a booster at this point is someone who is immunocompromised. And we're talking things like an organ transplant. You're on anti-rejection drugs because you've had an organ transplant, or you have other severe immune deficiencies. It doesn't mean that, well, I get colds easily and I have a weak immune system, or I have diabetes and I have a weak immune system. It's just those very specific cases. And I think, Sue, didn't the state just come out today?
Yes, we had a number of calls today, people asking when can I get my 3rd dose of Pfizer, and we said, we're not doing that yet, and people got very impatient. But we had to wait for our direction from the state, and we got that about 3:45 today. So we are formulating our policy, and I believe we're going to have an attestation form for folks to sign, listing some of the different conditions that would qualify you for the dose, But it isn't an exhaustive list. So if you feel you qualify and you'd like to have that and sign your name to it, we will give you the booster dose. And so we have the Pfizer vaccine, and that's the only booster we can give. If you've previously received Moderna, you have to get the third dose as Moderna, and it needs to be 28 days after that second dose. So Dr. Hayes was absolutely correct, of course, that moderate or severe immunocompromise is what qualifies you for the third dose. And I think maybe we should go into the rationale for that a little bit. So I'll start, and you can fill in.
Please.
So what I've learned is that the rationale is not that it wears off and we need a boost. It's that those people with that immunocompromise, their bodies did not work with the vaccine real well to begin with, and they only had maybe, X% immunity. And studies have been done doing a third dose with them, and it was shown to boost it to more of a immune response that the rest of us had after 2 doses. Would you like to add anything?
Sure.
Do I have it?
No, that's true.
You're better at the science.
No, that's true. I mean, and a lot of it has to do with when you first get a vaccine, the very first thing that happens, and when you get infected, same thing, the very first thing that happens with the vaccine is the antibody response is ramped up. And so that's sort of the first line of defense. The second part, and what the second shot in both the Pfizer and Moderna was meant to do, is to boost the immune response. And it's a little different than antibodies. It doesn't give you more antibodies necessarily, but what it does is it helps develop that memory, that immunologic memory, so that when the next time you might see or be in contact with SARS-CoV-2, the body right away takes care of it because it remembers it. And with people who are on anti-rejection medications for organ transplants or other other immunologic medications like rheumatoid arthritis, things like that, that second component is really impaired. And so that's what the booster is thought to be helpful for. I guess I would say, I mean, I don't know this, I don't consider myself expert, but it seems to me, and everything that I've read and seen, is that boosters for all of us is probably a for sure thing. I think it's just a matter of when, and I think for the vast majority of the population, we're looking at into the fall and winter, or the end of the year perhaps. So I don't think it's worth getting upset or getting rude on the phone to try and get your booster now, because I don't think I don't think there's enough data that shows that the vaccine has waned enough at this point. And again, we try to do all this by data. I mean, I know that there's a lot of cynicism out there right now that people think that there's a lot of maneuvering going on and this and that, and really, at least, and I can't speak for the federal government, I mean, but at least on the local side of things, we're doing our best to follow the data that we have and the information that we have and the experts that we have and access, so that we know what the right move is to make. Because obviously our goal is to protect everyone in the community, because we would love it if we were COVID-free from now on. I mean, so that would be our ultimate goal. But obviously that's a bit of a pie in the sky goal, wouldn't you say?
Well, we can dream.
We can dream.
I was also going to add that we will be ready on Wednesday to take your calls and make appointments for you to have that third booster at Door County Public Health. Tomorrow you will probably likely get the same answer if you call us. We are not taking appointments for that yet. We'll get there as fast as we can. And the reason I wanted to talk about the rationale is that, and to tell people, it's, as you said, there's no reason at this point for everyone to look at doing the booster dose. I was in a meeting today and the specific question was asked, when will healthcare providers need to get their boosters? Mm-hmm. And the answer was from our state medical officer that he didn't foresee that employment was ever going to be a reason to get a booster. It was...
Yeah. I mean, I think the bottom line too is that it's not a matter of us withholding the vaccine for someone to get a booster. We really have to, in many ways, I guess, to put it in as easy terms as I can think of, is we need to get permission to do it. Mm-hmm. We're given an allotment of vaccine, but if we start going rogue and doing what we want to do and not following the evidence and the science that we have, we run the risk of being removed as a vaccinator. And I know my name as a physician is pretty much on darn near all the vaccines in Door County. And so it's just one of those things where, there's a lot of things we'd like to do, but I find that what it all comes down to in many cases is how do we teach our kids? And we've all forgotten how we want our kids to behave because we're not behaving the way we'd want our kids to behave. So anyway, there's some really good questions, and I'm going to see if we can rifle through some of them because they're all really good. Where in the county are the majority of cases? I don't know that there's a specific, I know we were cagey about this in the first part of the pandemic, I think mostly because I know I personally had the desire not to scare people, but now it's just like, if I know something, I'll tell you. I don't know if we even know that. Is it really?
There are no particular outbreaks at this time.
Yeah,
And
that's a good way to put it.
There's no hot spots.
Yeah. And that's what I've seen anecdotally too, is it's just kind of scattered about.
And if you look at the national map on the CDC website of where cases are, the entire country is either orange or red, high or substantial. Yeah. It's just here.
Yeah. Annette asks, do we have a good supply of monoclonal antibodies? We absolutely do. And we're able to get that on a regular basis. And we still are, even though my understanding is we're not calling the positive results for everybody. They're on our patient portal. Those people that we do, every positive is evaluated, and we look to see if someone meets the qualifications for monoclonal antibodies, and we will reach out to that person to offer that because it really there's been a lot of good done with that monoclonal antibody from preventing worse disease.
And vaccine is in good supply also.
What's that?
Vaccine is in good supply.
Yeah, that's true. That's
Pfizer
a good point.
and Moderna. Johnson & Johnson, there's a little glitch with the supply to the state, but we're hoping that gets worked out.
Yeah. Judy, this is a question that, you could sort of say, well, let's blow past this because I really can't answer, and it's more of an opinion, but I have a concern. Why do people not have to mask at Packer football games, Brewer baseball games, music venues, bars, and President Obama's birthday party of 900, and I have to mask to go to the something or other? I don't mind, but mixed messages are confusing. Yes, they are. There's no question. Mm-hmm. But I guess, since when have we as a society allowed other people's bad behavior to dictate ours? So now all of a sudden we're using these things as excuses, and we're saying, well, look what we saw. We see these people are going to Packer games without masks. Therefore, I'm going to be equally stupid. And I mean, it doesn't make sense to me. So I think I guess that's as strong as I can put it. But I appreciate the comment and the question, because you're right. It does send mixed messages. And so that's what we try the best we can to just give, the facts as they exist. This will get even worse when kids go back to school. Will there be any strong recommendations from public health to the school districts? Yeah, they've already gotten it. They're just choosing not to listen to it at this point. So, I think the big thing is my experience anyway, is that people tend to go to kids really don't get that sick, and kids really don't die. It really is no big deal. And I always say that's exactly right. They really don't get that sick, and then that isn't the big deal. The big thing is, I think, having a 14-year-old who's in school is you have one kid that gets sick, and he has to be out of school for 10 to 14 days, and there's no simultaneous virtual learning, which I think is fine. That didn't go so well last year, but. Now all of a sudden they're out of school for 10 to 14 days. That's a problem. I mean, this kid is going to get behind. And if you have a whole bunch of people in the school, so that's my bigger concern, is if we're concerned about the kids learning, that's the concern that I have. So it's just, for me, it's as pragmatic as that. I don't know if you have any other comments to that effect.
Well, I do. Everyone's priority this year is allowing kids to return to school in person, after last year. And frankly, in Door County, our schools did really well with that, with minimal cases. And we have spoken to the schools and continue conversation, meeting with them on a regular basis. I meet with the school leaders on a regular basis and the school nurses. And they're well aware that CDC and we recommend universal masking at school. Students and staff are a mixed population of vaccinated and unvaccinated, and masks are a really important tool that we know work, and they work especially well when everyone wears them. And with transmission of Delta virus, yeah, it's really a concern. And Dr. Hayes said his concern was kids being out for 14 days of quarantine. Frankly, at this point, my concern is that kids won't be required to quarantine for those 14 days and will get an explosive amount of cases.
Yeah, yeah. I also think there's a lot of discussion too about masks covering up the face of kids, and you can't see their expressions and things. And there's probably a lot of truth to that. I don't think anyone really debates that so much. I'm no expert in that area, but I guess I look at it as, look, this could be, I mean, it could have been a short time if we'd have all just done it right the first time. You know, this could just be a short time and then we're back to normal. So I don't think this is by any means something we want to do forever. But, you know, I think we did, I agree with you. I think last year we did a really good job, and the schools really had their act together as far as, you know, getting everything ready. And we had kids in school the entire year for the most part. Most of the districts did, whereas many surrounding did not for most of the year. So I think there was a lot to be proud of in that aspect. So I just hate to see this year be kind of a mess. And I would love to be wrong about that mess.
Me too.
You know, and I just am concerned that it won't be. The other thing too is, even if you choose not to believe the CDC, if you say, well, their messages have been kind of mixed and they're weird, for what it's worth, the American Academy of Pediatrics and the American College of Physicians have recommended the same thing for kids to wear masks. And do I like that? No, I don't. But I think that makes the most sense. Mary Ellen asks, one of the morning shows, one of the doctors said that our immunity from the vaccine went down by approximately 7% each month. That means that those of us that got the vaccine back in January, February are getting down to 50 to 60% protection. Can I address that? I think I've heard that before as well. I mean, again, I don't know all the facts. I mean, I can't spew all the numbers. That sort of makes sense. I guess the one thought that I would say, I guess the thought that occurred to me when I read that is, the flu shot on an annual basis every year is about 40 to 45% is a good year as far as effectiveness. So we're still doing pretty well, but that probably doesn't answer your question. But you know, obviously we want to get the highest effectiveness we can out of the vaccine. Lori asked, when will kids under 12 qualify for vaccines? I'm hearing maybe the early part of 22. Have you heard?
Right.
Yeah.
Hoping.
Yeah. Are hospitalized patients in Door County vaccinated? That's a good question, and the answer is no. So we really are seeing, you know, I heard it said in a couple places that this is becoming a pandemic of the unvaccinated, and that's true. You know, it is not that vaccinated people can't get sick, because they can. But typically, vaccinated people don't have severe illness or hospitalization or death. They have mild symptoms, if anything. So that is what we're seeing. How many cases has Door County seen of positive cases in fully vaccinated people? I don't know that number. Do you? Do you have any information on that?
I do. So since July 1st, we've had a total of 15 cases that were positive either by PCR, so those are the confirmed ones. If they're positive by antigen, they're probable. So since July 1st, we've had 59 cases that were either confirmed or probable. Of those, 17 cases were breakthrough. So a breakthrough case is a case in someone who is fully vaccinated. And unfortunately, that seems to be increasing.
Yeah, and I think, you know, it's interesting when we first started seeing cases in people that were vaccinated. You know, it's always interesting. Human nature is an interesting thing, because people that sort of are anti-vaccination or don't like the idea of the COVID vaccine for whatever reason, you know, it's kind of like a Schadenfreude thing. It was like, see, people are still getting sick even though they're vaccinated. But I think, and I initially sort of took that as, or at least read it as, well, you know, the vaccine, we talked about how it's about 90% effective or efficacious. And so that means you've got 10% of people that could still, where the vaccine may not work. You know, it's like the flu shot. You can get the flu shot and still get the flu. It's possible, but you still bring the risk of that way, way down. And I think that's still partially the case. But I think the other part of that is that what we're finding is you still can get infected. We've always said that the vaccine prevents against disease, not against infection. And what that really means practically is if I'm vaccinated and I'm at Pick and Save and someone coughs near me and they happen to have COVID, I can get, especially if it's Delta, I can get that in my nose and my mouth. They call it the nasopharynx and the oropharynx. I can get it in those areas. And the viral load is so much higher that sometimes I'm able to get an illness as a result of that the vaccine doesn't have a chance to get on it. Because unlike chickenpox and some of the other vaccines where there's a certain amount of virus in the blood, this is all a mucous membrane infection. That's where it starts. And so the only way that infection can stop is once it gets into the cells and then the immune system attacks. So while it's still there, you can still get a virus and it'll sit there in the nasopharynx and oropharynx until the body reacts to it. So there is that time where you can become infected, or you can, more than that, spread it. And the point to that I'll add is that is the reason for the recommendation for masking when you go into public places. Because obviously the people, myself included, are saying, why the heck, I'm vaccinated, why should I have to wear masks when I'm vaccinated? It should really fall on those people that have chosen not to get vaccinated. And the reason behind it is just that I can, even though I'm vaccinated, I can get the virus into my nasal passage, into my oral passage, and it can sit there. And if I then move over to someone and talk to someone who might be immunocompromised and not vaccinated, or vaccinated and immunocompromised, that person can get seriously ill. So even if you don't have a sense of altruism, even if you say, well, what do I care about that person? I don't know who they are. It's also about spreading. It's, again, when we talk about stop the spread, that's what it has to do, is I'm giving it to someone who can then give it to someone else. And until that chain stops, the virus can't slow down. What we saw in the summertime is with vaccinations, that's why we saw the cases drop like a rock, because the chain was broken. We initially had this burst of immunity, both from vaccines and also from natural infection, by the way. We had a burst of immunity that allowed us to snap that chain. But then we kept sort of imploring people, please get vaccinated, because the longer the virus sits out there, the more it will mutate and become a more virulent bug. That's what we're living right now. So that's what we're trying to do, is just break that chain more than anything else.
You summed up the current situation really well just there. I would just add that in May, evidence showed that vaccinated people were not spreading COVID. And so that's when the CDC determined, we could go without masks if we were vaccinated. And I know it's frustrating to me too that now the evidence shows Delta is being spread by those of us who are vaccinated.
And Karen had asked, what about the Jansen vaccine? That's the Johnson and Johnson. I'm not sure what about it. I know that there hasn't been a lot of availability of that vaccine.
Right. So I have a couple comments on that vaccine. So there is a supply issue simply to the state of Wisconsin, and I don't know why that is. Other states have gotten it. Our vaccine rep at the state is looking into getting some from another state for us to be used locally. So I hope that's successful. The other thing, I'm not sure if you're asking about a booster dose for those who are immunocompromised. Right now, it is not recommended if you got the J&J or the Jansen vaccine. They're continuing to study it.
Mm-hmm. I'm just looking at questions here. I think this is a good question, and it's a fair question to ask. And both Sue and I are kind of representatives, so it's going to be, we can comment, but is the county and us, Door County Medical Center, suggesting shots to their employees? And if not, why not? I'll just answer for us. Are we suggesting shots? Absolutely. Are we mandating shots at this point? No. And there's a lot of factors to that decision. As a physician, I think it's a good idea to, if you're working in a healthcare environment, you should be vaccinated. But there's other factors as far as employees, availability of employees and things like that. And we've said from pretty much the beginning that we kind of would like the vaccine to have FDA approval. And I'd say that was what I'd said. And I will admit, if cards on the table, I will admit that I'm regretting having said that, because that kind of gave a mixed message. It gave the message that, well, if it's not FDA approved, therefore it's still, I hear experimental a lot. And the reality is it's not experimental at all. I mean, it's been through every rigor, every possible thing that a normal vaccine goes through. The only difference with FDA is the FDA goes and looks at all the plants and all the manufacturing facilities that make it, and they make sure they can reproduce it up to the FDA standards. So that's the difference. So, but we said it, and we kind of like to stick with our words. So that's kind of where we are right now. But it's a changing environment, so we'll have to see. I don't know if you can comment on the county.
Yeah, we are absolutely encouraging the vaccine. No mandates, and I don't expect there to be a mandate. Our HR has a system, it's called Go 365. It's an incentive for health, and we can get, I forget how many points if you get your COVID vaccine. So, encouraging us.
And I just realized, I'm sorry that I'm monkeying with my face so much, but I had this itch I couldn't reach right here. What's the process for someone who tests positive, no symptoms, and vaccinated? Do they still quarantine? How long?
Yes, if you test positive, as we've been talking about, breakthrough cases are possible.
Yeah.
And all along, asymptomatic cases have been possible. So we would count 2 days before that you were swabbed for that positive test. 2 days before that would begin your infectious period, and 10 days after we would ask you to isolate. And we would also, do the contact tracing, ask who's your close contacts. Quite obviously, household contacts are most at risk, and it's really, Delta is very efficient at spreading in households.
Yeah.
Yeah.
I'm just looking through questions here just to try and hit ones that would be of most interest. If you get COVID, should you still get the vaccine? Yeah, you should. Mm-hmm. It's great. You do have some really decent protection from having had COVID, but at this point, the best we understand, it really helps to enhance that immunologic memory, so that if you see it again, the body would fight it, would knock it down, so that you wouldn't get it again. So there's different conversations about, well, if you were sick, you could wait up to 3 months before you get the vaccine, but you absolutely can get it, and in my opinion, should.
We're told that it provides a stronger level of immunity than the illness does.
Yeah. Let's see. I'm going back here. Yeah, actually, someone, Diane just made a comment. I worked in healthcare most of my career, and I had to, I'm assuming had to get the vaccine. Well, we require flu vaccine and flu vaccine for sure, and also we when you work here, you have to either get vaccines or show proof that you're immune to things like hepatitis and things like that, and that's the way it is in schools too. So it's certainly not an unprecedented thing that vaccines are required. Let's see. Okay. Yeah, and Penny asked, is Door County only testing Delta at this time? Again, what we're testing for is the presence of SARS-CoV-2, which is the virus that causes COVID. And Delta is a variant of SARS-CoV-2. So they're all SARS-CoV-2, but they all have different variants. And a variant, again, just to reiterate, a variant is just a mutation that has taken place to the existing virus, because that's what viruses do. We always talk about they live to propagate themselves, and if the road to propagation is blocked off, they'll find a different route, and that can mean changing the spike protein that allows the virus to latch onto the cell. It can mean making the spike a little more difficult to defeat. I mean, there's all kinds of different things. So the risk always is, the longer that we allow a virus to go unfettered, the easier that variants rather can take place and can happen. And so, we don't want to see a worse one. There's some interesting stuff that I wish I'd have written it down. Somebody was talking about, we're probably, we'll see. One prediction that seems to have some really good basis to it is what we'll probably see is just like a little bit like last year. We're seeing the South lighting up now with a lot of cases, and that seems to be because it's hot in the South and a lot of people go inside the air conditioning. They go inside, and that's where virus really it spreads wonderfully. So you're seeing a lot of spread and a lot of cases, and that'll slowly eke north. And so this particular person, and I wish I could think of his name, has postulated that once we get through this, you're either going to, as I said before, you're either going to be vaccinated or you're going to be sick because of this. And then once you're sick, if you're one that doesn't get dreadfully ill and survives, which many do, frankly, then we'll have a lot of immunity. So then whatever herd immunity will exist because it will have gone through and sickened those who are not vaccinated. And again, not everyone, people love to quote the death rate. Well, the death rate's super low, and that's true. Thankfully it is. But the fact of the matter is, you don't know when you're going to get a case where you're going to be either really sick or you'll have long COVID. I know someone who was hospitalized for 34 days because their oxygen level just would not come up. It just stayed put, and they weren't able to go home because the oxygen they were requiring is not a level that could be sustained or provided for at home. So those are what you really want to avoid.
I heard a statistic today that 30% of COVID cases on average have symptoms that don't resolve, so have long COVID, and I don't have any study to back that up. That was a comment in a meeting. I don't know if you know more about it than I do.
I don't, but but that is what you really don't want. Is it's the people that I know and trust that are vaccinologists and immunologists have basically said they've sort of said, look, people a lot of times too I think are worried about side effects of the vaccine, which is just the immune system ramping up, and I personally would take those side effects every day and twice on Sunday compared to what I've seen people that have had COVID with. Not just people in the hospital. I have friends, I have people that before the vaccine was available got COVID, and it was miserable. And you never know when those symptoms are going to continue or get worse. The other thing that was interesting is we've already had 640-some thousand deaths. And if you look at the death rate, and I forget what the actual COVID death rate, the percentage is, but if that percentage applied to the population of the U.S. of 350 million, that means that we probably have about 1,000,001, I think, 1,000,001 deaths, 1,100,000 deaths due to COVID. So we're at 640 right now. So we could be seeing 400,000 more. And again, it's important to look at those numbers, because when people will say, as an argument, look at the death rate, it's so low, it's 99 point something percent survival. Yeah, that's great. But is 1,000,001, is that number acceptable for death? And is it acceptable to you if it's your spouse or if it's, so again, I do have to sort of think a little bit above and beyond ourselves when it comes to that. Are we seeing an uptick of vaccinations? I find it frustrating we're all going through this again because of those not getting the vaccine. Yeah, amen to that. But are we seeing an uptick?
At Door County Public Health, we are seeing more interest. We gave more vaccine last week than I think the last 2 or 3 weeks put together. So that was really nice to see.
Yeah, I agree. That's terrific. Should we be more concerned with indoor dining and unmasked wait people and bartenders along with buffets at this point? You want to take that?
Well, I'll start.
Sure.
It sounds risky to me. And I think in each situation we have to weigh what we want to be risky about.
Right. That's the key. That I think is the key. Is there is risk, and you just have to determine your level of risk. It's as we've talked about, it's possible even vaccinated that you can get it. I would be more likely personally to consider going into a restaurant as a vaccinated person without masking, because I feel pretty good about the vaccine, but you have to sort of decide. And again, the CDC is now recommending wearing masks when you're in public spaces for the reasons that we've talked about this evening. Again, whether you like it or not, I certainly don't like it, but it is, again, the whole goal of this is to try and cut off the virus at the knees, so to speak, so that it can't keep progressing. Someone had asked earlier, I'm going to go back up and look, and I think it was a good question. And that is to do with sports. What are your thoughts on school sports and games with other districts who have no COVID safety protocols or masking? Well, where my head went, and I'm not trying to be critical, I'm just trying to be as honest as I can be, I don't know that we even have safety protocols or masking. So I don't know that when it says other districts. But what are my thoughts? My thoughts, I'll tell you, as my son is going into high school, plays soccer, outside I've never had an issue. I mean, I think playing soccer outside, and I think doing any sports outside is a good thing. And I think as far as the coming winter sports, the indoor sports, we'll have to see. I don't believe around here, did we have any large-scale outbreaks or issues with like the basketball games and things like that?
So now I'm going by my memory. We did have some concerns with some teams.
Yeah.
Yeah.
So, I think last year was sort of a good help, and to some extent, although we were then, and now this is Delta, which is a little more, again, we've talked about how it's a little more virulent and able to be spread, but, I think if we're smart about it, I think it'll be okay. But outdoor sports, especially for spring and early fall, or not spring, sorry, fall, early and late fall, I think is probably okay. That's my opinion.
My comment would be I would like to see all those teens vaccinated.
Yeah. Mm-hmm. I'm concerned about congregational singing. Any insights on this? Yeah, that hasn't changed. That's the same thing. I mean, it's, again, singing has a similar force to not to coughing or sneezing, but it's up there, it's higher. So if you happen to have if you happen to be susceptible, you're more likely to get it in a church. And I know, just historically speaking, churches have had more of an issue with a lot of these, mask mandates and things like that. But again, you got to, look out for your neighbor, so to speak, right?
And again, it would depend too, inside or outside.
Yeah.
Better ventilation is less risk. Maybe not risk-free if you're really close to that person. But.
Yeah. Here's a good question. I don't know how would you answer this, Sue. What about kids eating lunch in the cafeteria without masks? I haven't let my kid go inside a restaurant this whole time, and that concerns me.
So one thought about that is that, they do, last year schools did some cohorting, although I don't know that they let a lot of kids go to the cafeteria last year. I don't think
my son was in the same room, the classroom.
Right, but that would help, then you're around the same people. And if there is a problem, then you know who you were with. Yeah, it would be risky depending how close they're sitting, right?
Yeah, I think so. I mean, I think, it's like anything else we're doing, if you, especially because they're not going to be requiring masks, I mean, that's the biggest risk is not wearing masks. But I mean, if back in the middle of this, before vaccines, before everything else, I went a year ago, July, went to the Rockies for a vacation, and we didn't really eat out in many restaurants, but we went in and we obviously had to wear masks. We took our mask off when we were eating, and then put it back on in between like large portions of the meal. I think if you do that, it's probably fine. I think again it has to do with how much exposure do you get. But I think the big thing is if masking, my worry is if masking is optional, we know what option people are going to take. So.
Yeah, that just wouldn't work with kids to have it optional.
As a follow-up to the buffet concern, am I aware of issues with people standing close together in a buffet line, or are there, this must have been dictated because I can't read this, and it's my wife too, are they with the transmission of the virus and the utensils, my whole thing with buffets has always been, from the beginning, that's one of the few things I've been right about, is that, the whole contact thing has really not been, it's just not a means of spreading this virus in any degree, in any effective way. So I've never thought that having to have people hand you stuff and you can't touch things, a lot of that is just silly. But I think if you're standing in a buffet line, it's not so much that you're spitting in someone's food, although that is possible. I think it's more you're close to someone else, perhaps. So I don't know how much, are there a lot of buffets around that are back doing their buffet stuff? I don't even know. So
I don't know either. They have advised the schools that they don't need to package their foods. The DHS has this in their guidance, that advising schools they don't have to do single-serve packaging of, that, as you said, that contact is not the big concern that we feared at the beginning.
Yeah. Angela asks, in other words, schools should be fully masked K through 12, not optional. And I'll let you answer first, and then I'll give you my answer.
Well, that is the CDC recommendation, and that is our recommendation also, along with we recommend layered mitigation strategies for schools. So not only masking, but distancing, looking at their ventilation system and maximizing that, cohorting, stay home when sick and get tested. The state has a program for schools where they can do testing in the schools, both for symptomatic and screening if they choose, at no cost to the school, although of course that would be more trouble, more to do. And hand hygiene, respiratory etiquette, all of that, looking at all of that.
And my answer, not coming from the public health perspective, but I agree with everything she said. I mean, I think the only thing I would change is I would say, as much as it pains me to say that that the kids and staff should be masked, because I really didn't, first of all, I didn't think we'd be here. I didn't think we'd have to. I think I even was on record as saying, I just don't see that we'll need to mask in the fall. So it pains me to say it, but I think it makes the most sense to do it. And for the reason that we've talked about, which is, I just don't want to see large swaths of kids get sick. And again, not because I'm afraid they're going to get horribly sick and die, although my colleague, the pediatricians, might say I should be concerned that they're going to get sick and die. That's less my concern. My bigger concern is these kids are going to miss several days of school. You get 10 days of school before you have to have a doctor's excuse, and it's a big deal in the school districts. And now we're acting like 10 days is really no big deal. If you get it, well, oh well, it's 10 days off of school. You miss a lot in 10 days. So that's my concern more than anything.
And I agree, masking is really, we're all tired of it. It's very difficult. The schools have a very difficult job. School boards have a very difficult job, but I really believe we have an obligation to the community to follow the science on this.
Yeah, I think you're right. Yeah, and since when have things been easy? I mean, an option, it's never really been an option just to throw our hands up and say, well, I'm done with this. It's just like, well, you may be done with it, but it's not done. So, and I also look at it too as, what example are we setting for our kids? So if we demonstrate this kind of behavior to our kids where we say, I'm just done, I'm not doing this. What about kids that can't stand social studies? Is that okay? I mean, are they just allowed to sort of say, well, I guess you can't stand social studies, so we'll just ignore it? No, they're going to get a bad grade, aren't they? So, I mean, maybe those are two different, it's a false dichotomy, but that's just kind of the way I look at it. Best place to get the fastest COVID test? I don't know that I know a good answer to that. I know we have a testing site here. You do testing. No?
We don't do
testing. I'm sorry, that's
no.
right, you don't.
Yeah,
that's right.
no.
We do testing here, yeah. You do vaccinations, that's right.
Yeah.
It's been a long week.
And we had the National Guard,
That's
way
right.
back. Thank goodness we don't need that again,
Exactly.
I hope.
So,
I would answer that at Door, and I'm not getting paid to do this commercial, but Door County Medical Center seems to have the fastest turnaround time that we know about, because you do the in-house testing, PCR testing.
Yeah, we do. And the PCR testing is the one that I think from, at least clinically as a physician, that I can hang my hat on more than anything. I mean, there are the antigen testing that you can do, and it has its place. I just haven't really figured out what the best place for it is. And so we don't really do it so much here. But if we really want to know if someone has COVID or someone is sick, we do the PCR. Let's see. Yeah, and Britta answered that question by saying the home test from Walgreens, the Abbott test. That certainly is, that's one way to go as well. But again, that's an antigen test. Mm-hmm. And so not that there's anything wrong with antigen tests, they just aren't quite as specific or sensitive as the PCR is. And it really, context is everything with the antigen tests. If you're sick, if you have symptoms and you test yourself, it's really helpful when it's negative. I think, if I remember correctly, because, if you have symptoms, you ought to test positive. If it's negative, that's helpful. If you're positive, you still need to confirm it with a PCR test, or you'd certainly want to confirm it with a PCR test. In the parlance of public health, it would be called a probable, wouldn't it?
Yes.
Yeah. If it's reported. I mean, if you do it at home, you're not.
I was just going to say that,
yeah.
yes, there's probably a lot of testing we don't hear about.
Right.
And the antigen test does need to be used in the correct situation to have it be a valid test.
Yeah.
Mm-hmm.
Okay. We're coming to the end of questions. Let's see. If the door concerned about the side effects of COVID, does that mean? Is the Door County Medical Board not concerned about the side effects of COVID because it means more dollars in the future treating the long-term health issues caused? Oh, I see what you're saying. Our hospital or whatever, we're not, I think if I understand the comment correctly or the question correctly, the question is, we're not really concerned about the side effects of COVID because that means we're going to make more money when people get sick. And if that's what the question is, I would say as a practicing physician, that is a slap in the face and that's obnoxious. We take an oath when we become physicians, and any clinician, we take an oath to do no harm and to do the best we can to take care of our patients. And obviously, like any field, there are bad eggs, but the idea that people in your own community would be so sinister as to hope for side effects in the event that we can make more money off of your sickness later, if that's what you believe, I feel very bad for you, because that is as cynical as it gets. As far as, this did bring up a good question, which I have a lot of interest in, which is the concept of people will say, well, I kind of want to wait for the vaccine because I want to see if there's any long-term side effects. And not unreasonable, not unreasonable at all. What I will tell you is all the vaccines that have existed for the 200 years, that's from the smallpox vaccine, every vaccine that has existed, no long-term side effects have occurred after 2 months. And that's according to really well-known Dr. Paul Offit, who is a vaccinologist and was one of the creators of the rotavirus vaccine. So no long-term side effects. So it doesn't mean that this is new and it couldn't happen. But again, I think if you're looking for that level of excuse, you really have to ask yourself, what are you trying to accomplish? So, we've already had, 160, 170 plus million people that have been vaccinated starting as early as December. I had mine at the end of December, just before Christmas. And it's been this long. I guess I would say at some point, what are you waiting for? Well,
I'm thinking of the long-term effects of COVID disease. We know that those can linger. So I don't know, I just don't have a hard time with people worrying about the side effects of the vaccine when the disease is real and can be quite devastating.
Yeah, I used to say, when I did primary care, at one time I used to sort of say, and I said it jokingly because when people have concerns, I appreciate those and I want to address the concerns, but people would often say to me, like what you'd say, someone would have a super high risk for heart disease and they'd have horribly high cholesterol and high family history and that sort of thing, and you'd recommend that they be on a statin drug, which I don't like statins, but sometimes it's, and they would say, well, I don't like the side effects of statins, and I would jokingly, in good humor, with a patient I had a good relationship, I would say, well, how does the side effect of death hit you? Not from the medicine, but from a heart attack, from a bad heart attack. So it's kind of the same thing. I think, at least from my perspective, having done this for a long time, practicing doc for a long time, we've got a pretty good data set with this vaccine. So when people choose to not believe it, I guess, what are you going to do? Let's see. Okay. We're about 5 minutes before 7, so we're just going to start winding down. I think, I'm looking back. I think Christy has a comment, the same one that asked about, are we trying to make money off people's suffering? No reason they should be mandating vaccines for hep, flu, and others, and not faxing for this, so they owe us an explanation why this is not mandated too. Well, okay. I guess you're going to believe what you're going to believe. I don't quite understand that, but okay. So, any last words of wisdom that you'd like to say?
I want to just remind everybody that vaccination is the most important prevention measure we have going for us right now. And overall, 65.5% of adults in Door County are fully vaccinated. So we've got a ways to go, especially in the teens also. For 12 to 15-year-olds, they're 34% vaccinated, and 17 to 18-year-olds are 39% vaccinated. So encourage you to seek out a vaccine provider. There's lots of us. Door County Public Health, Door County Medical Center, Bellin, and the drugstores, CVS, Walgreens, and Walmart.
Absolutely.
All in Door County. And
I also would put in a plug. The people that are behind the camera right now have been excellent in putting up an area on our website where you can put any questions that you have about the vaccine. And what we'll try to do is generate just a quick little video like we've been doing to answer questions about the vaccine, because I would really like to be able to answer some of the questions that people have about getting vaccinated, because I believe very strongly in vaccinations, and I'd love to be able to address any questions that you have, or what's stopping you from getting the vaccine, and what can I tell you that might help you. And again, it's we all make choices for ourselves and respect that. And so if I in some way can help shed some light on something, I'd love to do that. So go to the website, dcmedical.org, is it? Yeah, and put those questions in. Just a couple quickie last little questions. Are any news of stopping elective surgeries again? No, at least not here. We're not looking at that at this point. Not even close. So no. So things at this point are. That's the thing you have to realize too. I would say, is that things are nowhere near where they were at the height. So we're not in the same place. We just don't want to get there again. So that's why we're trying to kind of do our best to push for vaccination and just being safe. And the last question, and then I'll, there's a couple. So is 3 feet still a safe distance? That's a good question we want to answer. 3 feet?
6 feet's better.
6 feet's better. And then what percent vaccination rate is needed to reach herd immunity? Still 70%. I think they're saying about 80% now. And here's what's interesting about this. And I'm the last few minutes, I'm going to probably bore you to tears with this. But it's interesting, at least in my mind. So you want to know what percentage of the population needs to be vaccinated in order to protect everyone. There is a formula that you can plug in, that R naught that I mentioned, that infectivity number. You take R naught minus 1 over R naught. I know everyone's like, oh my God, it's algebra again. But R naught minus 1 over R naught divided by the vaccine efficacy. So now the R naught is 6. So it used to be 2, it's 6. So that means that the herd immunity percentage has gone up because of how infective the Delta variant can be. So they're saying it's more like 80%. But as I say, if some of the experts I've read are accurate, and I hope they are, by the time this Delta wave is done, if we can get through it in as harmless a way as possible, we may already be there with innate infection and vaccinations. But we can certainly get there faster if people choose vaccinations. So I guess with that, I will say thank you, Sue, for joining us. It's amazing how it's been 7-8 months, and it didn't feel that way. I was really surprised. I thought it was sometime in March, April that we did this last. So, you know, we'll take stock in the participation tonight and how many viewers we get, and we'll see whether or not we need to do this again, because we're happy to do it. We just want to provide a service that's helpful for everyone in the community. So in the meantime, I just wish everybody well, and be safe, and we'll see you around town. Take care.